Medicare changes every single year, and 2024 is no exception. As you probably know by now, Medicare comes in two parts. Part A is your hospital coverage, and Part B is your medical coverage. And today's video is really going to cover that medical coverage. Now, once you get medical coverage through Medicare, Medicare is going to pay 80% of the bill on its own Medicare-approved amount. But they're not going to do that until you pay the first $240 of their annual Medicare Part B deductible. Once you do that, you will owe 20% of the Medicare-approved amount. Now, Medicare comes at a cost, and the cost in 2024 is $174.70 a month. Now, not everybody will pay the $174.70 a month because the premium is really based on your income from 2 years ago. There's something called income-related Medicare adjusted amount. Now, depending on what your income was from 2 years ago will also depend on what you will pay for your Medicare Part B insurance. So before you decide to enroll in Medicare Part B, you better make sure what it will cost for you. Now, the medical coverage under Medicare covers things like doctors and specialists, labs, x-rays, tests, CAT scans, MRIs, outpatient surgery, physical therapy, preventative care, things like medical equipment, and many other services that are considered medical coverage. And it is optional to enroll in Medicare Part B, but only if you have creditable coverage. In other words, coverage that's at least as good as Medicare's coverage. So if you have a current healthcare insurance program that you're getting through an employer or even a previous employer, and you really want to keep that insurance, you absolutely can, as long as Medicare has determined that that coverage is at least as good as Medicare's coverage. And the best way to determine that is ask your human resources manager at the company where you used to work or currently work in and ask them, is my coverage considered creditable? And by law, they are required to let you know. And if it's determined that it's creditable, then yes, Medicare to enroll in it is absolutely optional, but it doesn't mean that you still shouldn't do it anyway. The best thing that you can do is really assess the cost of Medicare with maybe some extra coverage and just see if that still is a better value than what you're currently doing through your current group health insurance program. It's good to take a look, and many times it benefits you to still enroll in Medicare anyway. But if it's determined that your current coverage is not creditable, this is where Medicare will say if you don't enroll in Medicare Part B, we're going to penalize you 10% for every 12-month period you should have had Medicare and didn't. And what they do is they just add that to your monthly premium, and as the monthly premium of Medicare goes up every year, so does your penalty, and you're kind of stuck with that for life. Now, you won't have too many problems finding a doctor that'll accept your Medicare because 98% of the doctors in America will accept Medicare. So Medicare doesn't use a certain network of doctors like maybe private insurance does, but there are some things you should really take into consideration. There are some gaps in Medicare. For instance, Medicare doesn't limit how much your 20% co-insurance can accumulate to. And so you're probably going to need some additional coverage to help you pay for things that Medicare doesn't. Things like vision and dental and even prescription drug coverage that's routine that you get from your own pharmacy. So our recommendation is long before you decide to enroll in Medicare Part B, you should contact a local Medicare insurance broker. Normally, these guys, for absolutely nothing, will kind of give you advice on whether enrolling in Medicare is even a good option for you. I really appreciate you watching the video. Hope you enjoyed it.